Youth Day. We are working all for the bright future for our youth. So thank you once again.
Exactly.
So much.
I will definitely join again.
Yes, thank you so much. Let us move forward. Now we will invite our next guest, Dr. Sahid Adebesi, on the topic integrating the environment into One Health. So, Dr. Sandy, please, would you introduce our great next esteemed guest speaker?
Definitely, with pleasure. Before I introduce our speaker, a small hint about the pointer. So Dr. Shyama rightly pointed out the interlink with the various elements in our environment. So to safeguard our planet's health for the current and the future generation, we need to integrate the environment into the One Health. And to speak about that, we have with us Ambassador Dr. Shahid Adebisi, who is an accomplished research scientist, a sensational teacher, an author, a prolific writer, and he manages creative resources and he passionately advocates global sustainability. And his projects focus on promoting sustainability and healthy living. And he's a doctorate in plant genetics. And so his projects also focus on plants genetics and biodiversity conservation. And he's committed to finding innovative ways to combat climate change and support the ecosystem sustainability and promote a healthy planet. He's also a lecturer at the Osun State University, and he's engaged and involved in the activities that inspire future sustainability leaders while also fostering cross-disciplinary collaboration and knowledge sharing among stakeholders. As a global ambassador for sustainability promotion, collaboration and research with sustainability promoters and sustainability collaborators, SPSC UK, and by extension, a research global chair with the Global Sustainability Futures Network, GSFN UK, which is one of our partners here. And he's the former country manager to the United Nations Sustainable Development Solutions Network and the founder of Scholar Media. And he promotes green medicine and rare discuss sustainability, lifestyle matters, and sustainable living in research, networking, and book authoring, and other book authoring for sustainability solutions. We welcome you, Ambassador Dr. Adebisi, and look forward to hearing your inputs on integrating the environment into One Health. Welcome once again.
Thank you so much, and I want to especially thank the organizer and the invite the doctor that actually invited me, and also for giving me the opportunity to meet these very great minds to discuss and also share my perspective on that very important topic, integrating the environment into One Health. And I will quickly share my slide and also run through the thoughts that I put together. And of course, like every other members of the discussing panel have discussed, I will talk from experience, and also what I put together is also from experience, and also from my journey through the nature, and also seeing what people are actually doing to the environment, and how the science that I learned and I training as a inspire me to see how we can bring up the solution to actually address this issue. So I hope my slides are visible.
Yes, you are audible and your slides are visible. Welcome.
Yes.
Wonderful, wonderful, wonderful. So I start by saying that the One Health, which is the focus of this very discussion, it recognizes human, animals, and environment. And of course, it is about the interconnection and interdependence. And the overall goal of this very One Health is actually to optimize health for all, and also see how different disciplines and experts can collaborate. And when I studied the concept of One Health, I saw that there are few missing specialties or expertise or area of focuses that are needed to be brought into the concept. Apart from medicine, veterinary science, environmental science, public health, there is need for bioengineering, biotechnology to actually come into the concept, because that is where the real solution is going to come in. Then it offers framework for addressing complex health issues. It has been discussed and, in fact, exhaustively discussed by our first speakers. So I will leave all this area. And also it recognizes health challenges that occur, that it is affecting one another in different ways, and it also had help in addressing so many issues that have been discussed, like pandemic, antibiotic resistance, foodborne illness, and different things. But one thing that is that are yet to be mentioned is conflicts. And actually, One Health and the issues around it are actually conflict related, and also the quality of life. These are the perspective that I thought through my thinking. And also, yes, there was this very idea that came to mind. If we can have one health, and we are talking about environment, is the environment that we are actually living in as one that is affecting everybody. It's not one environment. Then I checked that, is there any concept like one environment idea? And of course, there is. And this is telling us that the earth we are living, the universe we all share with all other universal bodies, are actually one environment. And the advocates of this very one environment believe that we must work to protect and preserve the natural world as it exists. And also, if we want to secure the future for the next generation, we must do something to address the consequences of what we are experiencing now. And then I look back into this. This is a beautiful how nature actually created itself. Natural environment where we see the birds, the people happy, playing with animals, insects, microorganisms, aquatic water body, terrestrial water body, arboreal, and everything living in harmony. And also their functions make a balanced, healthier, happier, and prosperous natural environment that we are all made over 5 billion years ago. But now, look at human environment in agriculture. Look at what is happening in all this very picture. Look at human environment in local places where we live in, slums. Look at the garbage, look at the refuse, look at the waste. Look at human environment in the industrial environment. Look at it. Look at what humans are doing to the environment. Look at human environment where construction are happening. All these places in this very space are cleared up because we want to recreate something that is beautiful for us to live in. Construction, residential. Look at the environment of transportation because we want to move from one place to another. Look at how heavily we are polluting the environment. This is human environment. This is what human has turned nature into. And I summarize this very thought and this very scenario into the diverse way in which human explores, interferes, disturbs, recreates, utilizes, misuse, abuse, and manipulate the environment and its resources, have far-reaching consequences. And of course, it is not only that it is increasing the pre-existing challenges, but it is creating a new complex one, which we have been discussing ever since we started this very conversation. And of course, the planet is where we are all sharing. And the planet is, now, these are the environmental issues that we are all witnessing today. Increase in the temperature. Actually, there was this very term that is being talked about now. We were talking about heating up global warming before, but it is not changed to boiling. Look at the flooding. Look at the pandemic issues. Look at the animals suffering, extinction, biodiversity loss, land degradation. Humans are unhappy. And the children, they are suffering. That is the environmental issues we are actually looking at on that one head. And one thing that we have seen is that there are three major things that I thought through under the very environmental issue. We have the global warming and climate change. We have pollution of land, pollution of water, pollution of air. And we have habitat and biodiversity loss and impact. These are what is causing the human health, animal health, and ecosystem health challenges. Now, how do we achieve one health through environmental health integration? That is where my presentation focus on, and that is multi-level, cross-sectoral, interdisciplinary collaboration and partnership. This is very, very key. Then the second thing that I propounded was awareness, education, and advocacy. This very awareness, education, and advocacy had a long way to go in addressing this very issue, because the population that are unaware are more than the people that we gather here, or people that are aware in the academics or research, in the research world. The magnitude or the massive people in the population that are unaware, they are the ones that are going to create a lot of challenges to addressing this issue. And that is why awareness, education, and advocacy are very, very important. Then the third one is environmental surveillance. Of course, it has been discussed. Then improving regulatory framework, the government aspect, the local leadership aspect, at different level where we have to formulate policy. Then we are fostering innovative solutions. This is where the scientists and the engineers and innovators actually need to critically look into. So in breaking them down from my own thoughts, yes, we have the people, like I say, we have the industry and we have the government. And from the people, we have the leaders, we have the households, because the leaders are leaders of the community, leaders of different districts. We have the household, the father, the mother, the people that are elderly, that are having family units, the academia. They are the leader in their own institutions. The researchers, they are the leader in the focus of finding solutions. Then the industry, we have the investors, where they need to focus their investments, where they need to focus it. The manufacturers, the mindfulness of what to manufacture in a sustainable way, the businesses, where to actually do the business, the innovators. Then the government, we have the heads of government, the policymakers, the politicians, the institutions. This is where we have the multi-level partnership and collaborations. Then the education that I talk about, we have the people, the local campaigns. If not for the local campaign or the massive campaign about the pandemic, the history will have been something else. But the local campaigns still relevant and very, very relevant in the one head, social media, workshops, seminars, collaboration. We have the industry training of staff, training of different people that are in charge of the manufacturing and construction. Then we have collaboration, we have reward initiatives, because reward initiative is very, very important. It's very, very key in getting compliance and also cooperation from the industry. Then we have sustainability framework when they are designing their planning, then surveys and assessment to check if the industry are actually doing what is right. Then we have the government, sponsor campaign, expert consultation. What I've learned over the years with my interaction with the government people is that the majority that are into politics don't actually have the deep knowledge of what is happening in science. So they need expertise consultation. They need to get information to actually make the right decision as leaders of government. Then strategic policy, incentive programs, collaboration, then research sponsorship. Then when it comes to environmental surveillance, these have been discussed by the previous speakers, but I need to just mention them. Quality monitoring is very, very important. Pollution tracking is very, very important. Industrial hygiene, risk impact assessment. Most of the projects, most of the activities that we are actually carrying out in the environment, are we actually taking cognizance of the risk assessment of these things? Community engagement, are we really engaging our communities when we are talking about the very environmental surveillance. Government policies, epidemiology, research, these are very, very key. Then land, soil testing to detect what is happening within the soil. That is part of surveillance. What waste disposal system, like I've shown in my slide in the gallery of what is happening in our rural areas, in our industrial area, waste disposal system, land use planning. This has made our biodiversity and even the terrestrial habitats suffer a lot. We need to actually make a way to address this very land use planning. Sustainable agriculture. When I learned that agriculture actually contributes a lot to what is happening in the climate change environment, I was like, wow, what is happening? And of course, there are statistics that actually show that our agriculture is not sustainable mostly, which needed to be retract back to sustainability. Then risk impact assessment, community education, very, very important. Ecological mapping. Ecological mapping, we have to do a lot in this because different ecology has different characteristics. How certain ecological system can respond to the outbreak of disease is different because the inhabitants, the biological factors that are there are also different. We need to do a lot in this very ecological mapping. Then improving regulatory framework. These are need to do with policy, regulation, and also the different aspects that has to make people comply with whatever solution that is going to be preferred. Pollution control is very, very important. Capacity building, eco monitoring, threat detection. Threat detection is actually one of the key that I think one of our speakers has talked about. If we don't detect early, it can spread like a fire. And once it spreads, it can catch up the whole global space within short period of time. Threat detection is very, very key. Response system, how responsive mechanism are we putting in place? Innovative technology, green practices, then resources use, land use system, bioconservation, utilization efficiency, habitat protection, risk analysis is very, very key. How do we analyze our risk? There are so many projections about this very pandemic that help a lot in the response system, in the response mechanism that has really saved many lives. Then stakeholder engagement. I put this because if there are policies made without stakeholder engagement, without involving them, that is not inclusive enough. There is going to be a problem in the implementation process. So this is very, very important. Then fostering innovative solution. This is where I put my own idea up and say, okay, let's look at if we want to actually keep the head as one and maximize the well-being. What are the key innovations that we can look into? Then I put together epidemic simulator. We should design a system, a device or a machinery that is going to help us in this very epidemic simulation. Situation analysis is very, very important. Emergency signaling, very, very important. Spread prediction, transmission rate, population threats, recovery likelihood, control measures. This is what the simulator is going to do for us. Then ecotech sensor. This is another system or device that is going to be very useful. Risk detection, data gathering analysis. Data has a lot to do when it comes to either the prevention or either the management or either the even reoccurrence to prevent the reoccurrence. Then quality monitoring, emergency alert. Emergency alert is very, very important because if we have a biosensor that can easily detect most of these very outbreaks, it can be easy for the researchers or it can be easy for the policymaker to actually enact policy or regulation that can help to safeguard or to protect people. Then prevention guides. Then we have a green system modeling. This is the thought I also put together that imagine 500 millions of years ago, there was nothing like this very problem. And also, the world was just evolving. And the balance in the green-brown system is what has kept that very balanced and that very healthy ecosystem that we had then. If we can reimagine to design and model our green system, of course, we can achieve what we are all yearning for today. Sustainability design of this, eco-services analysis of if we combine certain population of plants, certain population of animals, certain population of microorganisms, certain population of to against the certain population of human beings. What are we going to get? Are we going to get the balance of the climate? Are we going to get the balance of the response? Are we going to get the balance of interrelationship? That is eco-services analysis. Then species performance. What are the performances of the species, of the plants, of the animals, of human beings that we are having within an ecosystem? We need to evaluate it. Then we need to use that one to model how we want our heads to be. Then predictive composition. If we are able to assess the species performance, we can actually make a predictive composition where we have imbalance in the species. We can use predictive composition to make up with it. Then functional efficiency. Then eco-health monitoring. Eco-health monitoring is going to help a lot in getting right our green system modeling. Then what are the possible challenges to the integration? Yes, if we want to integrate the environment into one head, we are going to face some challenges. And the challenges that I have put through is different priorities and language, different professions, different research niche, different aspects of our life are having different priorities and languages. Certain governments don't even have their focus on what we are actually discussing today. But how can we harmonize? How can we get their buy-in into this very one head concept or project? Then there is need to look at this very challenge. How are we going to communicate? How are we going to shift from the barrier of confusion and also difficulties that can mitigate against the implementation of one health program? Then funding and constraints. This is a huge problem. This is very, very huge problem. Then another problem is the structural fragmentation and coordination. It has, like, we have identified that there are different stakeholders. Then there is going to be a clash in coordination because allocation of resources, priorities, planning, execution, implementation, and different things are going to clash. How can we harmonize? It's going to be a challenge. Lack of data. This is where another issue is that is very huge. That is going to be a very challenging concept because if we don't have data, accurate data, informative data, well organized and interconnected, integrated data to actually speak to the challenges, there is no way that we can get it right. Then socio-cultural and political system differences. What is happening in Europe may be different from what is happening in Africa. These socio-cultural differences are going to be a barrier in achieving the One Health successful implementation. But we have other opportunities that are open when we integrate environment into the One Health, which is an improved cross-sector communication and collaboration strategies. Of course, the challenges are going to push us to actually look at how we can communicate and collaborate. And it's going to open up so many opportunities, so many opportunities. Then innovation in technology and data sharing is going to help us to integrate our data and focus on one objective that is going to be to save the world, to save humanity, to save the biodiversity. And that is where the opportunities lie. Then policy development and advocacy campaign is going to help a lot. The people that are going to advocate, the people that are going to formulate policy to actually have something to work with, that to the benefit of humanity is going to help a lot. That is a very fantastic opportunity that One Health is going to offer us when we integrate the environment into it. Then when we look at the One Health as a concept within the SDGs, what are we talking about? We are talking about the interconnectedness of human well-being, economic development, and environmental sustainability, specifically when environmental factors that impact human health, food security, water availability, life in water and land, and other development outcomes. That is what we are going to achieve. And One Health approach, as it is as a concept, that is well defined for the concept of health for humans, for animals, and all living on the planet. Then we are going to achieve that the SDGs are 3, SDG 11, SDG 13, and SDG 15 and 17, which is all band about human well-being, sustainable city and community, climate action, biodiversity conservation, both in the water and the land system, and also the partnership is going to help us to really achieve it. And in conclusion, I want to say that integrating environment into One Health approaches is not just a step towards achieving the SDGs. No, it is not. But it is a crucial leap towards creating a world where human health, animal health, and environmental sustainability are responsibly supported for ourselves, not only for ourselves, but for the planet. Not only for the planet as it is now, but the future generations that are yet to come. And of course, if we get it right, definitely we are going to leave a legacy behind that is going to tell the story of the emergence of the world, the events of the planet, and history of the contribution of everybody that has lived on this very planet. I thank you all for this very opportunity, and I so stop here. Thank you.
It was a full power-packed presentation, Dr. Shahid. Really amazing it was. You are just unstoppable, right from the start to stop. You didn't miss anything, which is on the action. In fact, 6 of integrating the environmental into One Health. It was a brilliant one. With the increasing recognition of the health of the humans, with the domestic and the wild animals and plants and the environment, to show the closed linkness and the interdependency, and in every form of environmental degradation, that giving the direct and the negative, indirect negative consequences, everything with the effects of air, water, and soil pollution, the human and the healthcare, and which are totally well documented and presented. For example, leaving not aside the biological and the chemical pollutants within the wastewater and the runoff in the livestock, and the enhancing the propagation of the antimicrobial resistance, definitely. And also about the land use and the change driven of the agricultural, industrial, urban expansion, etc., all contributed so well. And it was a full sum up to prevent. And also, I love the conclusion part of it, to prevent and mitigate these threats. The importance that you focused on the biodiversity conservation, environmental, the public health, the animal health, the veterinary sectors. We need to understand the interlinkages, beautifully presented, really, and speak with one voice, implementing One Health in a most harmonious approach. That's really beautiful. And the mandates and the priorities of the environmental sector need to be fully integrated. Totally agreed with you with the One Health approach, including the integrating environment with the data. You didn't miss that. Beautiful. And also the decision making and the fostering for a better understanding, creating awareness of the environmental issues in One Health community, addressing the challenges, boosting the capacity of the environmental and all the stakeholders of the institution to have an equal voice of one unison of one voice towards the One Health table, and in the process of decision making to protect and restore biodiversity, prevent the degradation of the ecosystems and the water and the environment, to jointly support the health of the people, animal, plants, and the ecosystem, underpinning sustainable developmental goals of the 13, 14, 17, and last but not the least, even the 17 one that you have covered. Beautiful, amazing presentation, Dr. Zaid. Very proud of. Thank you so much. Thank you.
So we now